this is the disc that we exposed. And then if you work up and around, here you see the back of the vertebral body. Here's the pedicle coming up, and this is the cranial aspect of the L4 pedicle. And then this is the SAP, the superior articular process of L4 in the foramen. And I expose these landmarks on every single case that I do transforaminal, regardless of whether the pathology is in the canal or in the lateral recess, in the foramen, or far lateral. Cranial is to the right, so over here, and you can actually see that little bit of fat over there. The exiting nerve root's going to be kind of up in that area, so that's where it's kind of tiger country. So you want to stay away from that area, or put as little pressure there as possible. Caudal is here, so this is the pedicle of L4, the top of the pedicle, and then you can start to see here. Can I have that cautery again? This is just some disc material in the foramen. I'm just going to clear that out here. If we had a foraminal disc herniation, this would be it. I mean, I might be done with my case right now. So let me show you that ligamentum flavum. I'm just shrinking down this disc material here that's in the foramen. And then this is a really nice picture. It's not as yellow in a cadaver, but this material just dorsal to my probe right here is ligamentum flavum right here. So actually, from a transforaminal approach, especially if you take a pretty far lateral starting point, you can do a decent lateral recess decompression. So let's take the drill actually. So I don't always drill, but it certainly can help if you need to do a foraminoplasty, either because of foraminal stenosis or because you need to get into the canal. So what we're drilling here is really the non-articular undersurface of the SAP. And there's nice biomechanical studies that show that you can really have a substantial foraminal expansion while destabilizing the patient zero, because you're not touching the joint surface itself. So again, I'm just drilling out the undersurface of the SAP, a little bit of the cranial aspect of the L4 pedicle, which is over here on the left. So I like to show myself these landmarks because if I'm underneath this SAP, I know I'm in the foramen, right? You don't need to take a bunch of x-rays. If I'm lateral to it, I'm far lateral. And then if I'm medial to it, I'm in the canal. So all this area over here is in the canal. So if you had a paracentral or central disc herniation, you could very easily get in there. Let's just take an x-ray. I've looped around the pedicle here, x-ray there. And so you can confirm you are exactly where you need to be. And if we had a little bit more time, we could advance into that region there and get into the canal itself. So that's that epidural fat right there in the ventral epidural space. Hopefully that was helpful for you guys.